We've all had upgrades to our phones and technology. Today we're sharing an advancement in tried and true technology for our heart patients. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Fatigued and breathless, Mike Kruger knew something was wrong. When she arrived at the University of Kansas Health System, she found not only a diagnosis and a solution, but also a blast from the past.
To understand Michaeline Kruger, who goes by Mike,
I try to just make sure that every week I have at least 150 minutes of activity.
you have to keep up with her.
Walking's the easiest thing everybody can do. We all know how to do it. It doesn't take any equipment. You can do it anywhere.
She's raised 3 children, now grown, was a flight attendant for 35 years, and then began her second career in public health 8 years ago.
I love my job. I love my coworkers. I always say that God gave me my best job as my last job.
The 68-year-old is now a community educator for Johnson County, dedicated to helping people quit smoking. And she intimately knows the devastating effects of that addiction.
My dad smoked 5 packs of cigarettes a day. He was only 47. He had his first heart attack.
He passed away when he was just a year younger than Mike is now. And Mike has always made staying active and staying heart healthy a priority. So a few years ago, she was frustrated when she began feeling exhausted all the time.
I would go to work, and typically I could come home and go walk or do a bunch of things, and I was tired every night.
The real red flag, her smartwatch.
I'd be just sitting watching TV or something, and my watch would go off. And it would give me an alert and say that my heart rate was 32.
Her doctor ordered an EKG, which revealed something unexpected. Mike was experiencing PVCs, premature ventricular contractions. Extra heartbeats were disrupting her heart's regular rhythm, and her heart was working in overdrive. That's when she was sent to University of Kansas Health System electrophysiologist, Dr. Seth Sheldon.
The whole time during the visit, I was looking at him, I'm like, gosh, he seems so familiar. But after being a flight attendant for 34 years, everyone seems familiar to me. And I woke up in the middle of the night and I'm like, Sheldon, oh my gosh, that's baby Seth Sheldon.
She realized Dr. Sheldon was actually the son of one of her best friends from college.
And she and I were Pi-Phis up at KU.
Together, Mike and now Dr. Sheldon agreed on a plan to get her heart back into rhythm with a special robotic procedure.
Which I loved, actually, so it was kind of like he was going to go in and play a video game with my heart.
On procedure day, Mike was ready for Dr. Sheldon, aka Baby Sheldon, and yes, she leaned heavily into the nickname.
When he came in, I said, you know, there's no pressure here, but if anything happens, you know, you not only have my family to answer to, but your mom.
They both laughed, and then Mike says she closed her eyes. And then,
when I woke up, you know, was in recovery, he came up and said, well, how'd I do? I said, A+. So, and I immediately, you know, emailed his mom and said, thank you so much for having Seth. I appreciate it.
We are so excited to have Mike Kruger here with us this morning, along with our electrophysiologist, Dr. Seth Sheldon. We promised Dr. Sheldon we wouldn't call him Baby Sheldon, but man, we want to. We won't do it this morning or ever. Don't worry, I won't do that in the halls. We're also joined by Dr. Madhu Reddy. Dr. Reddy is the chief cardio electrophysiologist here at the health system. Mike, how are you feeling this morning?
I am feeling great. A little early, but good.
You arrived at 7 a.m. because you're a flight attendant.
Exactly.
So you're used to being everywhere on time.
To
It's so exciting to see you both back together and to have everyone here on this journey. Now, Mike, you said that your dad died of cardiovascular disease very young, 67, so heart health was already top of mind for you. What preventative steps were you taking before this to make sure your heart was healthy?
Well, knowing that I did have a heart history in my family, for one thing, I knew I was never going to smoke because I saw the damage that did. Mm-hmm. And remember, this was that many years ago, so he only lived 20 years beyond his very first heart attack. And during those years, he had I had a stroke, another heart attack, so it was rough years. And he was still, you know, young. And so seeing that as I became an adult, when you're young, you don't think about anything, but as I became an adult, I knew that was going to be important for me. So I knew some of the steps that I needed to take. Obvious ones like, regular exercise, watching your stress, sleep hygiene, all the things that we try to do well on, our diet. So that became a priority for me. I also explained that to my adult children, this is what you came into the world with, so you're going to have to work with that.
Right. So how long were you feeling fatigued, short of breath before you saw a doctor?
Probably somewhere like 3 to 4 months, I would say. But really it was my watch that was the thing that then made me think, okay, this seems weird, because I am pretty technologically oriented, and so I knew my watch was working correct, and I knew that was weird. So I would get those little signals, and it would literally, my heart rate, it would say like, alert, alert. And it would be
32.
34. So I called my internist, and she's like, I don't think that's what's going on. So when I went in for my physical, she just ran an EKG on me in the office, and she said it was PVCs. But at that time, they weren't so bad. And that's when she referred me to Dr. Sheldon. I got to go to him, and that was a virtual visit, which is why I had a hard time recognizing him. And it was during, kind of around COVID, so it was just, a Zoom visit.
So this was all happening during COVID, when everybody was just navigating the virtual visits for the first time. Did you ever babysit for Dr. Sheldon?
No. So we were sorority sisters, but through the years,
of course,
we all stayed connected and know what everybody's kids are doing, of course, and bragging on each other's kids.
Yeah.
So while I didn't see him, I always knew, I was like, oh, that's right, he went to med school. But I didn't really know what his specialty was,
Yeah, now you do.
And now I do.
Well, you do now.
And I'm really glad.
When your smartwatch was alerting you that your heart rate was that low, what did it feel like in that moment?
So I am somebody who never felt that. I have friends who have PVCs, and that's what they notice first, is that they feel like their heart is skipping a beat. I really never noticed that. My real symptoms were the fatigue, and breathlessness. The breathlessness was the most annoying, because, when you're trying to do anything and you're just walking from here to here, and you were like, why am I out of breath? It was almost like when you go to Colorado. That's what it
And it was a different altitude, it felt like, which would be weird for someone like Mike, because you are go, go, go. Now, Dr. Sheldon, I want to talk about the premature ventricular contractions, or PVCs. We have an image that shows Mike's heart. What were the areas of concern? And this is actually her preablation EKG. So talk us through this.
Yeah, so basically there's a normal beat and then an extra beat every other beat. So we call this ventricular bigeminy. And in this situation, it makes the effective heart rate a lot slower, because the heart's a pump and it has to pump and then fill before the next beat. So if it pumps and then tries to pump again, it never filled, so it doesn't create an effective heartbeat.
Mike, when you put your hand on your chest, could you feel any difference in the beats? So you didn't feel any of that?
No. But he did explain all that to me, what was actually happening, which at least that made sense to me. And he explained how, when the chamber didn't fill up the whole way, then it kind of makes up for it by those little beats in between, which would explain why on my watch it was only picking up the big beat and not the little beats in between.
Okay, and then we have video of Mike's heart that we want to show. Dr. Sheldon, this was taken during an MRI. What are we looking at here?
So in an MRI, one of the main reasons we do this for PVCs is to make sure that there's not underlying structural heart disease. So sometimes PVCs can be a manifestation of some bigger problem going on within the heart. And so this gives us a chance to look at the heart structure and function, and mainly to rule out really scary diseases or scar tissue within the heart or inflammation within the heart. So here we see the left ventricle on the right side of the chamber with the thicker walls and the right ventricle with thinner walls, and we see that the pumping function of the heart is preserved with this.
Okay, so this was good news when you looked at this part.
It was great news, yes.
Dr. Reddy, Mike underwent an ablation. What happens during an ablation?
Ablation is a common procedure we perform. It is trying to identify the abnormal signals in the heart and eradicating them. So many of the arrhythmias are caused by abnormal signals. They can be coming from the upper chambers, lower chambers, right at the junction. So during the ablation procedure, our first goal is to find where they are, and then we eradicate those abnormal signals by delivering some kind of an energy. Most commonly we deliver radio frequency energy, and now we have a different kind of an energy that we deliver that will eradicate the abnormal spot that is causing these abnormal signals. So in Mike's case, Probably there is a spot in the lower chambers of the heart that was causing the PVCs. So Dr. Sheldon went through the groin, going to the, we probably may talk about it, and went there and then delivered that energy at the spot.
Little
and then
zap.
all it takes is a small amount of time, 60 seconds of energy delivery, and then it takes away the abnormal beat altogether.
We have some really cool illustrations. Dr. Sheldon performed Mike's ablation, as Dr. Reddy was saying, with the help of a Stereotaxis robotic system, which Mike said was like, she said he was playing video games with my heart. Not how they describe it in med school. But I want to take a look at this animation, the series of animations we have that shows what it looks like when Dr. Sheldon was using that robotic system on Mike. So explain what we're seeing here, Dr. Sheldon.
So on the left, it's kind of talking about manual control, which is the traditional way we do ablations with our hands and with a deflectable catheter. On the right here, we see two magnets that come in next to the patient, and by creating a different gradient of magnetic field around this catheter that has a magnetic tip, it can drive the catheter to certain areas within the body. So the magnets give it direction, and then it has a drivetrain that can make it go advance it or pull it back. So with doing those two different manipulations, you can drive the catheter to different areas within the heart.
And so you're the little blue doctor operating it from the console.
Yes, so you gain access and get the catheter in the heart, and then you step aside and scrub out and go to a computer console. And we have this huge screen that has really a bunch of different screens within it, 7 or 8 different screens. And that gives us a chance to direct the catheter and look at multiple images, an X-ray image, look at an ultrasound image of the heart, have a 3-dimensional map of the heart as well.
That's incredible, the accuracy with which you can do this. And Dr. Reddy, the robotic system uses magnets. We have a great illustration at that technology. What are we looking at here, Dr. Reddy?
So on the right side is the main catheter, that is the ablation catheter. The catheter basically has electrodes at the tip and a magnetic chip inside. And that magnetic chip can be controlled by the magnet, which is the person is holding it in his hand. And we can move the tip of the catheter. It's very flimsy, that makes it very easy and mobile to move and turn around the corners of the heart in different directions. That's why when we have a complicated anatomy of a patient having areas where the abnormal rhythm is coming from a different location or difficult location to access, it always gets harder with the manual manipulation to get to that corner.
Do all the
but by
twists and turns.
Yeah. So this magnetic one, it actually feels like a big noodle. It's that soft.
That's so cool.
Catheter.
We have another video that I love. It shows how the catheter moves into the heart with the robotic system. Now, Dr. Sheldon, you went through Mike's groin all the way up to her heart. Explain what we're looking at here.
So this shows a diagram of the heart here, and we basically go through the access in the blood vessels within the leg and drive these into the inside of the heart. And then this shows, in some situations, we make a needle puncture through a septum, so through a wall within 2 of the chambers within the heart to gain access to the area of interest.
Is that what you did with Mike?
For hers, we actually didn't have to go through any walls within the heart. We came up the aorta, so through the artery and then to the aorta and across the aortic valve.
And you can see the turns, and you're controlling every turn in this with the magnets, those giant magnets on either side of her.
This really shows how flexible the catheter is. So
Yeah.
it can make a 90-degree, and it can even loop and do lots of different maneuvers within the heart as well.
Both ways that you do this procedure, manually and this, are always considered safe. The manual way is very safe. Why was this particular one with the magnets and the robot safer for Mike?
It's a reproducible amount of contact you get with this catheter. So it typically has somewhere between 7 to 15 grams of contact force, which is kind of just the right amount. So it allows us to make sure we have the catheter up against the wall and reach a difficult to reach space, but not have excessive force and some of the risks that go with that, such as perforating the heart or creating a hole within the heart, which we don't want to do.
You don't want it bumping along the walls of her heart. Are there any patients who can't undergo the robotic procedure?
It just depends on where within the heart we're planning to do the ablation procedure. There's some areas that it's probably more efficient and potentially safer not to use the Stereotaxis or magnetic-driven catheter, but this particular system is really advantageous for difficult-to-reach areas, and especially for people that are born with not the usual heart structure.
And that's when you would do it
Yes.
that way. So when you're operating the catheter manually, How are you able to, I get the magnets and how they guide it. What are you doing when you do it the other way? How are you controlling the catheter through all those turns through a heart?
Yeah, that's a complicated question. Just ask our fellows that are learning how to do
Yeah.
this. So basically, you have a number of different manipulations you can make. You can advance the catheter, you can pull it back, you can rotate it, and then you can deflect it. And so by using a combination of movements, each of the catheters has a little pulley system on it, basically, that allows you to deflect the catheter. And you can do that with the handle that you're holding on to. So between those different movements, you can usually get to a lot of the areas within the heart.
So I would imagine the pressure, I guess being a surgeon or a heart cardiologist, you're always under pressure, but what would happen if you got a cramp in your hand? Do you ever stress about that? That would be
It does kind of stress your hand muscles a little bit in certain positions. I remember when I was learning to do these procedures early in training, and you get asked to hold a catheter in a certain position for minutes at a time, and it can become really challenging, but your hand muscles do get stronger and more used to it.
Used to that.
Yeah.
That's wild. We already have some great questions that are coming in. If you have a question or you have a comment or something you want to say, send it to us on YouTube, Facebook, or the All Things Heart email. We'll be answering your questions in real time. You can find the links of how you connect with us right now on your screen. Dr. Reddy, I want to talk about the Cardiac Robotics Lab here at the health system. It opened 4 months ago. You are super excited about this. How has it changed patient care for you?
Yeah, so the background is we had a robotics lab for quite some time. We are the earliest site, or one of the first sites in the Midwest to have a robotics lab from 2008. And there's a new version of the robotic that has come up, the magnet, and that's what we revamped the entire lab, did a completely new fluoro system. All the technology in the room is new. So it's a brand new lab with the latest technology, probably one of the few sites in the country which has this. We just started about 4 months ago. Right now, as we mentioned, we try to use this magnet, this room for complex cases. So we have this option to do it now. In the past, when it was under construction for a few months, we did not have this option, so we are excited about it.
Those are the magnets that we're looking at, those big green things.
Yeah. That is, I think during the maintenance, we can't normally see the inside of it, but those are the magnets. So it's huge.
They're huge.
They're huge.
So obviously everybody has to take off anything metal when you're in there. And how much of a difference has it made with the kinds of procedures you've been able to do over the past 4 months?
Yeah, so the complex patients, I think it makes a huge difference. We have to select the patients right. So many of the times we are able to do manual cases. That means with manual catheter manipulation, we're able to get to most of the patients. But there are some patients in whom we will not be able to do it if not for the robotics.
Dr. Sheldon, when you talk about training and you had to hold the catheter and that kind of thing, how long do you have to train on the robotic assisted devices before you can perform these procedures?
There's no set amount of training for this. This is something that there is a training program that's facilitated by the company and gives you a chance to work on simulators. And the simulators are actually quite good and enable you to learn how to manipulate the catheter and adjust the screen such that you can see where the catheter is going. So usually with some time on the simulator and going through a training course with the industry program, you can be ready to go with this procedure.
Mike, I want to talk about the connection again between you and Dr. Sheldon and Dr. Sheldon's mom, who's your bestie from college. You were sorority sisters. Did it ease your mind when you realized that you had this special connection?
Well, of course. I mean, anytime you can make a connection with somebody that you might get a little extra pull,
right?
I'm going to take it.
Did you feel the pressure, Dr. Sheldon?
I try to.
I hope that you do the same for everyone.
I feel pressure and responsibility in any procedure we do, regardless of whether it's going to be one of the more challenging procedures or not. We want to go in like it's a family member's heart or a very close friend's heart.
It's your mom's best friend.
Yes. So I take every procedure seriously, but yes, that added a little extra pressure too.
Did your mom call you the morning of the procedure or the night before and say, "Hey, Mike's coming in"?
I learned, we talked about it, I think, the day of, but we waited until afterwards. And of course, I had Mike's permission before I talked with my mom about it at all.
Oh, right,
Yes.
because of HIPAA, but I'm guessing you had called his mom
Yes, of
first
course.
and said, hey, your
Yes.
son's going to be performing a procedure on my heart.
Yes.
Which, how weird is that when she's probably frozen in your mind as your college buddy, and then you have her
Yes.
son.
Well, and we had a
performing your
very
heart
small
procedure.
pledge class, so we all, there's a lot of secret handshakes and things going on. So we have been, those friendships you make are eternal friendships.
Right.
They are. And so Amy was literally one of the sweetest, nicest girls in the house. So I love her and was thrilled. I was like, and it's, every mother knows you got to be proud if you have
Oh,
a son
gosh,
who's an
yeah.
electrophysiologist, right?
Are you kidding me? Your moms must be through the
know.
moon. As a mom of a 17-year-old, if my son was performing heart procedures
Exactly.
on my friends in about 10 years, that would be, I'd be so proud. I want to get to some of the questions from our viewers. Remember, you can send them to us as well right now. Stu wants to know, how often do the doctors hear about a smartwatch detecting cardiac problems? Are these smartwatches game changers for detecting problems? Dr. Sheldon, I'll start with you, and then I'll go to Dr. Reddy.
Absolutely. I think this is a new advent in technology we have with the wearable devices, and it's led to earlier detection of rhythms that maybe would have taken years to diagnose previously, and people are getting an alert from their watch and following up and getting the necessary care. So yes, some of these times it's a false positive and it's not really a concerning findings, but a lot of the times it is something that's real that needs further follow-up.
Dr. Reddy, can we safely say watches are saving lives because they're getting to you earlier?
They are, definitely. It works both ways, right? Not only does it make us diagnose the condition earlier, but it also raises the awareness. People didn't know what AFib was before, and now everyone knows what AFib is, and
Right.
every time they buy. And the watch penetration in the market is so high these days, and every commercial company or watch has a program to detect AFib. AFib is only one of them. It can detect so many other things, and I think the watches are saving lives for sure.
I mean, just having hosted the show for 3 years, I can't tell you, probably a couple dozen patients have come to our cardiology team because of their smartwatches.
Yeah.
Jeremy has a question, and this touches on the training. He wants to know, how do you keep up with and learn how to use all the new techniques as stuff like this continues to get developed? Dr. Reddy, was robotics around when you were in med school?
Oh, no way. so it's all, that's why for what we do, it's a lifelong learning. And what we trained, even I was training 12 years ago, what we trained is not what we practice right now because the tools and technology are completely new. We go for training, additional training on a monthly basis sometimes, every quarter at least, where we see new technology coming up. And whenever we are using a new technology, because it might be an implanting tool, or if it may be something that we are putting in patients' hearts. So we want to make sure that we know everything about it, the pros and cons. On the other hand, we are also an academic center. We participate in research. So while participating in research, we always get a heads up in knowing what the technology is. And while using it as a part of the study, we again know the pros and cons, advantages, disadvantages, and what are the challenges. So we help the companies design the tools which can make the best outcome for the patients.
We're on the cutting edge of anything new.
Which is why I wanted to be at KU, right?
That's why you wanted to be here.
Absolutely.
Because you're getting the best and the newest.
And I like to know that I'm at a teaching hospital where they are the most advanced and have everything at their fingertips.
Literally, right at your fingertips. Vera has a question. This is a great question. She wants to know, can you do the current method if you have a pacemaker? She's talking about the magnets. Can you use the magnets with a pacemaker?
Yeah, so the pacemakers are designed not to, or to be used in a magnetic environment. So a lot of the newer devices are capable of being done with MRIs and other things, and the same principle applies here. So they usually are not manipulated by the magnetic environment, and we can use this system in patients that have pacemakers and defibrillators.
Can you can do the manual as well with the pacemakers and defibrillators? Yen Liang writes, with this new technology, will it make people feel less discomfort during procedures like cardiac catheterization or heart valve replacement, and will the incision size also be reduced? Let's start with the discomfort. How did you feel after you woke up?
I felt really good, and it didn't take long. The hardest part is when you have to lay there still. That's the hardest part.
And that's after the procedure?
Yes.
Yeah.
And explain that.
Well,
to our
if someone
viewers.
tells you that you can't do something, of course, it's the very thing you want to do.
Especially you.
Exactly.
Mike.
So they're like, you need to not move. And then this was the threat that worked with me. They said, and if you move, that clock starts over. I was like, no. I'm not even going to talk. So that was the hardest part.
Do you attribute her feeling so good afterwards to the new procedure, reducing the pain?
I think the new procedure is helpful, and then we set expectations for what to expect after the procedure and about the flat time, and so she was mentally prepared. And she's somebody who typically has a very positive outlook, and I think that really goes a long ways toward these procedures as well.
I'll bet it does. Dr.
When you know that you're getting a good outcome too, you're excited to,
Right.
And it resolved pretty fast too.
So positive, such a positive attitude, which is like medicine. We often hear from our doctors. Dr. Reddy, what about the incision size that Yen Liang asks about? Is that reduced because of this?
So I just want to clarify that this robotic procedure is for ablation procedures and not for the heart valve and cardiac catheterization at this time.
Okay.
Having said that, the difference is if we have a robotic procedure like this being performed, sometimes we may have to make fewer access sites, so that can make the recovery a little quicker. But not always. Sometimes we use the same number of access sites and the sheath size is also similar, in which case I think the recovery would be similar. But in difficult, challenging procedures, sometimes when we are not able to get to it manually, we use more access sites, put in more catheters from different angles. That makes the procedure longer, and obviously the recovery will be a little longer from there.
How long was Mike's procedure?
I don't recall exactly, but probably somewhere in the range of 2 to 3 hours.
And then you're done.
And then you're done.
You're up and at 'em. When were you out and
I think I just
walking?
stayed overnight and left the next
Yeah,
day.
I usually stay one night and then go home the next morning if everything looks good.
I love that. I want to get some final thoughts from our guests. Mike, I want to start with you. What would you like our viewers to know?
I guess I would like the viewers to know that you shouldn't be afraid of maybe something that you're not familiar with, like a procedure like this. We went through some other things prior to getting the ablation. We tried, pharmaceutical intervention by taking medication, which didn't help. And he had prepared me for that. And then there was just a point where they got worse. And they got worse to the point where I was like, we need to do this. Let's go tomorrow. And so I would tell people that to be aware of what your body, right? And when you have those signals, don't wait too long. I think that's the real critical thing. A lot of people will say, yeah, I'm going to go to the doctor, and we all hear tragic situations where they don't get there in time. So when you start feeling things, call your internist, do all the things to try to stay healthy, but all your screenings, all of that. But ultimately, if you need to get some help, then get to your doctor. And pick a good one.
Pick your best friend's son. The expression "be like Mike." Be like Mike. Mike is the star patient here. Dr. Sheldon, what do you want our viewers to know, or Mike to know?
Well, I just want to say thank you to Mike, obviously. She spent much of her life in public health and has been such a tremendous advocate for health of our country and health of the people in our region as well. And I think this is just another example of that. I think she's using this disease that she's unfortunately had to deal with that was not her fault. This is something that just kind of came up and can happen to anybody. And she's used this as an opportunity to educate people and improve their lives.
Dr. Reddy?
I want to take this opportunity to make sure our viewers know that at University of Kansas Health System, we have one of the biggest heart rhythm management program in the Midwest, and we do more procedures than any other organization around here. And we have the cutting edge technology with the latest tools, and we just want to make sure that people know about that.
Case in point, Mike.
Yes.
And we love sharing the incredible work of our doctors here at the health system, but have you ever wondered what your doctor does outside of work?
Now for a secret look into the guardians of healthcare at the University of Kansas Health System, let's go behind the mask.
We're starting with Dr. Sheldon. By the way, I want some baby pictures next time you're on. I mean, come on. It's like you got to give it to us. Most of the pictures you do share are with your family and you're outside. What are your favorite things to do with your wife and kids?
Yeah, so as the pictures show, we love to spend time outdoors, going on family bike rides, family ski trips, going to the beach, things like that. So a lot of these are cousin time too, so some of my nieces and nephews in the pictures as well. But this is from the lake in the summer, and we have a great time together. I've got 3 little girls, and they want to be on the show sometime too. They've really
Bring them
asked for
in.
that, so.
Do they want to be doctors?
Maybe one of them, but we'll see. It's still early, but
We'll figure out a way to work them into the show either way. You need to bring them with you
they're
into
happy
the
to
studio.
do Taylor Swift performances.
Perfect.
Yeah.
You said the magic words.
Yes.
Taylor Swift. Up next, we have Dr. Reddy. Dr. Reddy, you have a gorgeous family as well. Look at your kids, and where are you there?
I think that's Dubai. Yeah, if I remember it right, yeah. So we like traveling. My wife, she's a pulmonary critical care physician here in town. And our kids are twins, 14-year-old twins, freshmen in high school right now.
Oh boy,
Yeah.
that's an age. Freshman year in high school. You're an electrophysiologist, the chief electrophysiologist. Your wife is a pulmonary cardiologist.
Critical care.
Critical care. It's a lot of brain power under one roof. What about your kids? They interested in medicine?
One of them maybe, but yeah, they are still evolving. One of them wants to go into finance, but they just started their high school. We'll see.
Plenty of time.
Plenty of time.
Plenty of time. Thank you so much for making time to be with us today. And Mike, thank you for sharing your journey. What a great panel. Coming up next week on All Things Heart, a first of its kind in our region, cardiovascular genetic counseling, how you can use it to plan for the future and help manage your heart health right now. That's next Thursday at 8 a.m.
Coming up tomorrow on the Morning Medical Update. It's been called the mystery disease because it's painful, hard to diagnose, affects fertility, and can lead to cancer. I'm Jessica Lovell on the next Morning Medical Update. Researchers are learning more about endometriosis, how that knowledge is changing everything for one young woman. Friday at 8.